in terms of the effort-related tests, the malingering tests, where are they falling within this timeline, if you remember?
Yeah, they're kind of all over the place. Some of the measures were in 2011, some were in 2012. I'd have to specifically look at each test. I have actually a list, I believe, there someplace, but some of them were administered in 2011 and some were in 2012. And in all fairness, as I said previously, while I did highlight those things that reflected poor effort, there were some measures where he showed adequate effort. The problem is that it wasn't consistent effort. The problem was that there's not consistency in terms of his performances or effort level, for that matter.
Yeah, out of curiosity, can patients have good days and bad days?
Of course.
Will that impact the testing, the effort, etc., so significantly?
No. We certainly expect some variation in performance, right? So if I saw you today and it happened to be a good day, and then I saw you another day and you didn't have a good night's sleep, or you had a fight with your husband before you came into my office, and that was affecting you in some fashion, then I might see some variation. But I wouldn't see this huge variation in performance. I wouldn't see this drastic decline in terms of how you were doing. So nothing was done as far as I could tell in 2013. The patient wasn't seen for any testing by Dr. Caddy or Dr. Surloff. So the next time that there is some kind of assessment is with me in 2014. Now, this area here that had been assessed 2 years prior, did I write that? Oh. Okay, here we go. Same exact test that is now administered actually 3 years later, because this was administered in 2011. High average visual attention.
Could you give us the name of the test again, please?
Sure. It's the spatial span subtest of the Wechsler memory scale.
You just spit that right out, huh?
Luckily, my memory is okay most of the time, unless I have a bad day. So just to give you an idea of the difference here, over here his score was a standard score of 110, which translates to the 75th percentile. That is the top 25% of the population in terms of his performance. This performance was a standard score of 65, which puts him in the bottom 1%.
So he literally went from 110 to 65 on the raw scoring and top quarter to literally bottom 1%.
Exactly. Exactly.
Is there, from a neuropsychological perspective, is there any explanation for that?
If somebody has a dementia, that is, they're declining, they have Alzheimer's.
What is that, from a neurological perspective, consistent with, if anything?
Objection, Your Honor.
Sustained mental impairment.
What does that, the reduction in scores over 3 years, or 2.5, what does that tell you?
When I see,
but don't remember our specific instruction beforehand. Yeah. Don't render any medical opinions.
Okay. So when I see a patient that's declining like this in my office, when a neurologist is sending me a patient because he wants to see, is the patient the same as they were 3 years ago? Have they declined? Have they improved in terms of their functioning? Then that would be consistent with someone who has some kind of progressive disorder in the brain.
Okay. By the way, one-time traumatic brain injury, is that a progressive disorder?
No.
Dr. Valdes, what else do we see in 2014 in terms of comparison between the tests?
So in 2012, he was given a reading test, and he was re-administered the reading test. And in 2014, his reading had been at the upper end of average, and then when I saw him, his reading was low average. So again, showing that there's a change in terms of how he's doing. He's not doing as well as he had been doing a couple of years prior.
From upper end of average to low average, is that neuropsychologically significant, or is that just a little change?
Yeah, so this was, I believe, a score of 105, and this score was an 86. Actually, this was a 102.
I'm sorry, what's that?
This was the reading recognition, word reading test.
So is that a significant change or is that a little change?
That's a big change. You're talking about a decline of 16 points in a 2-year period of time. In addition to that, reading is one of the areas that is typically not affected by a number of different disorders. When we're looking at how somebody is doing cognitively, oftentimes that gives us a little window into how somebody might have been functioning beforehand. And so that oftentimes is how this reading test is used in the battery of tests. When we look at his drawing ability, which had been low average here, it was impaired. And this was the RAID complex figure copy, where he had to copy a complicated figure, and he evidenced an impaired ability during my evaluation. Similarly, his visual memory for that was impaired. Whereas when I scored, I believe it was Dr. Surloff's data, that performance was also low average. So there was a decline both in his ability to copy the figure and remember the figure. When we look at his problem-solving skills, and so this is part of the IQ test. He has to take blocks, manipulate them to match designs, figure out visual patterns, visual puzzles. His problem-solving abilities were low average. Whereas previously his problem-solving abilities on 2 of these 3 were in the average range, whereas now they had decreased to all dropping a category into the low average range.
Doctor, in 2012, I see impaired problem solving. So we've gone from average to impaired to low average. What does that mean?
There's fluctuation in terms of how he's doing across these examinations. And again, as I indicated previously, if there is a problem that's related to a neurological illness, then you're going to see consistency of performance, not varying performances across the different examinations.